So my dear, management of pain is one of the greatest challenge in medical science. Okay, pain means in general an unpleasant sensations. Okay, we are having lots of painkiller in simple language, but medically we cannot suppress pain completely even we are having many painkiller, because if we suppress pain completely, then patient will observe the outcome of adverse effect or severe side effects of painkillers. Okay my dear, analgesia, one class I told you, analgesia means perception of pain, and analgesic are those group of drug who abolish, terminate, stop the perception of pain, the feelings of pain. Okay, there are two types of painkiller in generally or analgesic. One is NSAID, non-steroidal anti-inflammatory drug. Another is opioid analgesic. Already we have discussed about NSAID. Now we will discuss about opioid. First, I would like to tell you what is the difference between NSAID and opioid analgesics. In between two, okay. The opioid analgesic are more powerful or potent than NSAID, but in therapy, in general therapy, it is not encouraged to use opioid analgesics because of their dependent ability. They produce dependence. Only in case of emergency and only in defense it is highly used. You might have seen the picture Tango Charlie. In that movie, the troop of Bobby Doyle, one of the cadet of Bobby Doyle of VSF, cut by Chinese. Okay, then they cut the person. At that time, Bobby Doyle throw one injection. That injection is morphine, which aims to kills the pain or suppress the pain immediately. Kahinki na war injury is what happened? Something kona bahut dangerous. काटी पकईथिबे गुली बाजिथिबो से टाइम में किछि उपाय नहीं, नो इंटरवेंशन, ओनली opioid analgesics, the drug is morphine, they suppress or fulfill the purpose. Okay, then what is the disadvantages of NSAID? You know there are two disadvantages of NSAID. One is it causes gastric ulcerations, peptic ulcer. Why? Because the main mechanism of NSAID is inhibition of COX. When cyclooxygenase enzyme inhibited, then what happened? Prostaglandin formation is decreased. Prostaglandin is the mediator of pain. Then pain must be abolished. But what happens simultaneously? Prostaglandin has gastroprotective effect. It makes a barrier around the stomach in between acid and smooth mucus. In the absence of prostaglandin, hydrochloric acid directly touch or irritate mucous membrane and causes ulceration. Besides it, another severe disadvantages of NSAID in chronic use is that it has nephrotoxicity, because prostaglandin has another good role. It increases the renal blood flow. When renal blood flow increase, it facilitates excretion. So in case of continue or chronic use of NSAID, like in the case of your rheumatoid arthritis, osteoarthritis, in which condition patients are taking NSAID for long time. In that case, what happened? Their prostaglandin level is decreased because inhibitions of cyclooxygenase by NSAID decrease the level of prostaglandin. When prostaglandin level decrease, then what happened? The renal blood flow or the renal blood flow pressure is decreased. As a result, sodium retention is there, resulting edema, because prostaglandin good level is responsible for good renal blood flow. Okay, then what happened? Due to sodium retention, edema occur, and simultaneously it increase the vasoconstrictor substances. So there is a chance of vasoconstriction due to it activate angiotensin 2. So my dear, like other drug, opioid drug or opioid analgesics, they are adjusting their actions through receptors. The different opioid receptors are present in different areas of CNS and peripheral sensory nerve fiber. The main distributions of opioid receptors are brainstem, spinal cord, medial thalamus, limbic system, hypothalamus, periphery, and immunocells. There are three major kind of opioid receptors: mu, kappa, and delta. Among the three receptors, the affinity of morphine is much more towards mu receptor. So the other name of morphine is mu receptor agonist, as it shows maximum tendency to bind towards mu receptor. In general, in two sentences, I can clarify the mechanism of actions of opioid analgesics or morphine-like drug that they decrease calcium efflux. Due to decrease of calcium efflux, their decrease of release of excitatory neurotransmitter, and they increase or they facilitate opening of potassium channel. Due to opening of potassium channel, the perception of pain to some extent is also abolished. Okay, my dear, in next my classes, I will describe the pharmacology of morphine. It is also important for your exam point of view. There is an important questions: classify opioid, write different type of opioid receptors, write in detail about morphine. Due to lack of space in my mobile phone or other problems, I cannot continue the video. Okay.